I do have some brand new data, taking this from, as much as the country is discussing sort of social determinants in these broader intersections, that is certainly not the political conversation in Washington right now. I have hot off the press, just released today, new tracking data on what Americans and Republicans and Trump voters think of this bill. But before, I gotta make you sit on your seats for one more second. I wanna say something, pick up on what Sue just said about not voting in their interests. This is one of the things that's always been challenging, right? You often see the case where particularly sort of lower middle class, less educated white voters do not appear to be voting with their pocketbook or in their interest, because especially in this last election, there was a big choice between what kind of social contract the two candidates were going to provide for you. But what's interesting, and we've just finished a big survey of rural voters, and we did focus groups, funny enough, in Ohio as well, Ashtabula County, which was, everybody in the world is doing focus groups in Ohio with Trump voters right now. I'm just going to say it's like the hot new industry. But what was so interesting in our data and in those conversations is that these Trump voters, and again, this is a county that had voted, 16 points for President Obama in 2012, and now 20 or 30 points for President Trump in 2016. What they said around the table is, yeah, I got insurance, or I buy it this way, but my deductibles are so high, my copays are so high, I have to be dead before I go to the doctor. But those people on welfare, they just get it for free. And they can just go and get what they want for free. So what we were hearing around the table, and this other family, this woman was saying, me and my husband sit around the table all the time, and we just we put up our hands, like, why are we working so hard? If we just went on welfare, and again, I'm not sure factually it's welfare or it's Medicaid or they're in the markets and getting subsidies, but if we were just those people who have won the lottery and don't have to do anything and get it for free, then they'd be okay. And so I think that in their minds, they really were in some ways voting their self-interest, in that here was a candidate who was promising to make things fairer for them and to get rid of government abuse of benefits, which is something that is really driving their thinking, because they do feel very left behind. And so, when you do talk to them, the first issues on their mind are jobs and opioid epidemic, which I know we will talk about, but that's feeding a lot of these health outcomes as well. They don't talk about healthcare per se, unless they're talking about it as the fact that even if they have it, they can't afford it. And so the number one thing to take away from this conversation is what Americans want from their healthcare system. What Americans want is to pay less for healthcare, and that's all they've ever wanted. So with that, I'm happy to tell you the headlines from our poll, if you want me to go there.
Yeah, let's go.
Okay, so what we know as of this morning is that the ACA the favorability on the ACA has, for the first time in our polls, we've done it for over 7 years every month. So I've had about 100,000 respondents. For the first time ever, favorability of the ACA is at 51%, unfavorable is at 41%. On the new Republican bill, the favorability is at 30%, and unfavorability is at 53%. What's particularly interesting today is that Republicans, who of course have favor the Republican bill, but their enthusiasm has really dropped. So in May, when we did ask the same question, 2/3 of them said they favored it, and now it's down to just about half. So they dropped 11 points in 1 month, which is a very big deal in polling. I think that what you can say about Republicans and Trump supporters with respect to the bill that dropped yesterday is that they want repeal of the ACA. They always have wanted repeal of the ACA. They don't really like the stuff in this new law, and they're pretty lukewarm about it, but they do want repeal. And so that is sort of the dilemma for senators. They are actually, there is no way you could say that senators designed this bill based on public opinion polls. They may have consulted public opinion polls, but they certainly didn't follow what they say, because this bill is not consistent with what the American public says they want, or even what their constituents say they want. So you have the legislators who are going to put forward a big change, and if they do pass it, in 2020, 2022, these Trump voters and Trump supporters could be very surprised by what repeal and replace ended up meaning, because what they're going to get isn't what they want.